News Now is brought to you by the Bank of Guam, the People's Bank. From the Pacific News Center in Hagåtña, Guam, here's Clint Ridgell and Janella Carrera with Betsy Brown and Roselle Romanes. PNC Sports with Blake Watson. And weather with Joanna O. With your news now.
Good evening. You're watching PNC's News Now. We are broadcasting live in Saipan and in Guam. I'm Clint Ridgell.
And I'm Janella Carrera. Hafide, good evening. Your top story tonight: a lack of government services made it difficult for Judge Michael Bordallo to set a timeline on the trial of alleged baby puncher Yu Hua Han. Han is accused of punching a 10-month-old baby at the Micronesia Mall earlier this month. It was all caught on camera and it went viral on social media. Han was charged with felony aggravated assault and child abuse, but she has pleaded not guilty by reason of insanity. Because there was no Chinese interpreter available today, Judge Bordallo could not set a scheduling order. Also, it was revealed in court that Han has not yet had a forensic evaluation performed on her. On January 14th, Judge Alberto Tolentino ordered that Han receive a psychological evaluation within 10 days. According to the Superior Court, there has been no physician available to conduct Han's evaluation. Han's next hearing has been scheduled for March 12th at 9 a.m.
Imagine entering the 9th grade knowing that you've been given $500 to attend college, and that money will continue to grow. That's Senator Narissa Underwood's dream for public school students, and she hopes to make it a reality through Bill 35. PNC's Betsy Brown has more on the First Generation Trust Fund initiative.
65% of all jobs are expected to require an education beyond high school by the year 2020. That's according to predictions from the Georgetown University of Education. And that's also why Senator Narissa Underwood wants to make college more accessible for the island's youth. She's authored Bill 35, which would create a trust fund account for every public school student entering the 9th grade. And each trust fund would begin with a $500 balance to use at the University of Guam or Guam Community College. Superintendent John Fernandez offered his support for the measure during a press conference this afternoon.
When I talk to our students, especially those who are headed to graduation, I always ask them, okay, you want to go to college, you know you're going to graduate, what are you doing to ensure that you get in? GCC or UOG is, obviously great options. Do you expect to put yourself through by yourself, and do you know what that means?
It's this year's 8th grade class that would be the first to benefit from the bill, and all they have to do to qualify for the program is remain enrolled in a Guam public school and graduate. Where will the government get $500 for every student? According to the legislation, the Foundation for Public Education will provide $75,000 each fiscal year beginning in 2016 to fund the program, and the Department of Education will have to provide $75,000 more out of their appropriation. UOG will give $250,000 and GCC $150,000. So far, the legislation does not include any provisions to lock tuition in place, but co-sponsor Judy Wampat spoke about the possibility during today's press conference. Senator Rory Respicio is also a co-sponsor for the measure. Betsy Brown, PNC News.
Guam Memorial Hospital Administrator Joe Verga says that concerns Vice Speaker BJ Cruz raised regarding the newly opened urgent care facility are unfounded. In fact, Verga says concerns such as a fee schedule and CMS certification have long been addressed. Vice Speaker BJ Cruz sent GMH Administrator Joe Verga a letter this morning outlining concerns he had regarding the hospital's newly opened urgent care center. The first issue Cruz raised was over a fee schedule. Cruz believes that the center has yet to set fees for new services.
In fact, we had a meeting with all the insurers prior to urgent care opening, and where we discussed the fees and the fee schedule with the insurers, and we modified our fee structure to cover our cost to a mutually acceptable rate.
The second point was compliance with the Centers for Medicare and Medicaid Services. Cruz, in his letter, said that, quote, GMH should ensure that the new center complies with the CMS conditions of participation and reimbursement.
It is our responsibility to make sure we're in compliance with conditions of participation at all times, in which we are. So the Urgent Care Center is in compliance with all CMS and Joint Commission requirements and expectations currently, since we are both an accredited and certified hospital.
Because it falls within the GMH.
That's right, because it falls within our purview.
The third issue, says Cruz, has to do with a reporting requirement under Guam law. GMH is required to submit to the legislature its plans for the Urgent Care Center ahead of time. Cruz believes the hospital is not in compliance with this law.
The plan, the resolutions were submitted to the Speaker's office last February 14th, 2014. I regret the Vice Speaker obviously didn't get his copy, and I will be happy to provide him one.
Verga also points out that the reports submitted to the legislature were stamped received the same day it was submitted. Finally, Cruz says he's concerned that with the addition of an urgent care center at GMH, there may be a redundancy in government services, such as urgent care services at the Department of Public Health.
Public health is, their federal grants prohibit them from operating as urgent care. In fact, they do not operate urgent care. And in fact, we do coordinate with them. They were part of our urgent care planning committee. I was, kind of confused when I received this letter because I didn't know where it was coming from. But all the concerns that he raised here were really, unwarranted and unfounded.
You can read the letter Cruz sent to Verga online at pacificnewscenter.com.
In an effort to expand their services and address the physicians shortage on island, the American Medical Center is in the process of bringing in a new breed of young, energetic doctors to the island. One of them is Dr. Rumi Iqbal, who just moved to the island from Seattle, Washington. Although still young in her profession, Dr. Iqbal has over 5 years' experience in treating patients and has had the benefit of being able to practice under the Obamacare transition. Dr. Iqbal says she's excited about being able to work in small, tight-knit communities and looks forward to serving the people of Guam. American Medical Center physician Dr. Vince Akamoto explains why they hired Dr. Iqbal.
And so in looking for partners, we admired Dr. Rumi's independence, her very openness, and it looked like she'd be a good fit for our more or less caregiver-driven model. So their perspectives are fresh, and a lot of times they're evolving. And although Dr. Rumi is still very young, she's an experienced doc, and we're very lucky to have someone who's had already a career in the States and in the HMO. We're going to learn a lot, I think, from her.
I think to be a good provider, physician, you really have to care for the patient for what they're there for. Otherwise, you're not doing them justice.
Dr. Iqbal's contract is for 2 years, but she says if all goes well, she hopes to stay longer.
Is your child coughing up a storm? Well, the local public health is warning parents about whooping cough after lab results confirmed 2 children with the disease on island. Department of Public Health and Social Services Immunization Program Manager Annette Uggan tells PNC that the cases involve an 11-year-old and a 2-month-old. She says the 2 are not related to each other and have no off-island source. Uggan says public health is further investigating the cases to determine the possible sources of exposure on Guam. She explains that whooping cough, or pertussis, is a respiratory infection that can cause severe coughing or trouble breathing. Uggan urges parents to review their children's shot records to ensure they have received the whooping cough vaccine.
We strongly advise, especially for families with newborn or young infants, to ensure that anyone who's sick, to keep them away from their young infant, immunize on time. The vaccine for pertussis, the first dose is given at 2 months of age. It is a 5-dose series though, and so in order to build up proper immunity, the child has to receive these doses properly spaced. So you're looking at 2 months, 4 months, 6 months, then again at 1 year of age, and then at 4 to 6 years of age.
All healthcare providers on Guam are advised to be on alert for possible cases of whooping cough and to report suspected cases to the immunization program at 735-7143.
All right, and stay tuned. We'll be back with more after this. Sorry.
I had to take an afternoon nap. I was up early this morning covering golf for the Governor's Cup. You want to know all about it? Stick around. Sports not that far away. I'm going to take a quick nap, but I'll see you there. I'll be awake by then. Setting my alarm to 5 minutes, 10 minutes, extra 5. See you in sports.
Hey,